Improved Medicare for All will be financed by a premium that will be less than what 95% of us now pay for health care. There will be no deductibles or copayments. You may worry that without paying anything, people might abuse the system. Some people feel that everyone needs to have some skin in the game to keep them from overusing health care. That's mainly speculation without much evidence. Some studies have shown that people with high deductibles do cut down on medical care in the short run. However, they are as likely to miss needed care, such as preventive or primary care, as they are to skip something that might be considered unnecessary, like an extra MRI on their sore knee. Cost sharing refers to all the costs the patient bears, such as deductibles and copays. It's a fancier term for skin in the game. Robert Wood Johnson Foundation, a respected healthcare organization, studied cost sharing. They noted that it probably does not decrease the growth in healthcare costs. The elderly, poor, and chronically ill who had to pay more for prescription medicines had higher emergency room and hospitalization costs. And if people are spending more time in emergency rooms and hospitals, that means they are sicker. We want our neighbors to be healthy and living their lives, not spending time in hospitals. Studies show that 1 in 3 people either doesn't get care or delays care due to these hurdles. Many people don't get prescriptions filled, and many others don't take the medications as prescribed in order to stretch out their prescriptions longer. That could be fine until they find out that what they skipped was finding out they had a treatable cancer or infection, or that their blood sugar or blood pressure was too high, or they have a heart attack or stroke because their blood pressure or diabetes wasn't controlled. My own experience and practice reflected this. Every day, I saw patients who didn't get some kind of needed care due to expense, or I didn't see them because they missed appointments because they didn't have enough money on hand for their copay. But don't deductibles and copays help pay for health care? Well, they certainly help private insurance companies' profits if they keep people from seeking treatment that the insurers would have to pay for. But it gets back to the administrative overhead that we've talked about before. It turns out that the administrative cost to bill for, process, and collect these deductibles and copays is about the same as the revenue collected. So they add more expense to the system, keep people from seeking care that might nip a problem in the bud, and don't seem to help anyone but insurance companies. They may be an annoyance for healthy people who are also wealthy. But sick people are not only contributing skin, many of them are also down to the bone. Sounds like skin in the game isn't such a smart idea after all.